Shalom. This is Sister Gabby, broadcasting live simultaneously from my YouTube and my Facebook page that is Herbally Defined and or Mother's Herbal Instincts. And this video is just a really quick, important labor tips video for the different sisters and different young women who are into labor and delivery right now. Active labor and delivery. I've been getting quite a few emails, quite a few messages, and even some phone calls. And so I wanted to do this video just in case you may be someone who's not able to get in contact with me to get encouragement or assistance during your labor. Okay, so this video is just readily available for any and every person who needs it. And I thought that it'd probably be wise for me to share the same things that I have been sharing with a few of the moms who are moms now, who have delivered their baby successfully. And I wanted to put that on here just in case you're not able to get in contact with, just in case you live, the enemy is trying to come up against you, and getting in contact with Sister Gab, because sometimes that happens. People don't get in contact with her. Any things that they would have known before. That's why I'm doing the video, and I'm hoping that it's beneficial to any and every mama, any and every daddy who may need it. So even if mama can't watch the video, papa can, and recite these same things to mommy as she's in labor. So the main three things I'm going to talk about is labor, delivery, and placenta birth. All of those are very important. Okay, they all work together. So if we mess up in one area, or we are not knowledgeable in one area, it can kind of throw off in the other area. Okay, so first things first, I'm going to start with labor. I have my book here. A couple of things I just wrote down really quick that I don't forget to say, which I've probably made mention in some of my videos that I've done previously, but I'm going to make mention of them again and then just kind of go into more in-depth detail, especially if this is your first time delivering a baby. If this is your first time actually going through a vaginal delivery, whether you have 4 or 5 children, vaginal delivery is completely different from a cesarean delivery. You're going to feel different things. Okay, your experience is going to be completely different than the experience you had with going into a cesarean delivery. So a VBAC delivery is just almost the same as a first-time mom giving birth. Okay, because the matrix still has to be broken, and the canal has to be broken into as well. So with labor, you want to make sure that your hips are open. When you enter into active labor, that's your 2 to 5 minutes apart consistently for an hour. That's active labor. And when you don't go backwards, you want to stay in between the 2 to 3 minutes, and then you're going to slowly get down to 2 minutes. Then you're going to slowly get down to a minute and 30 seconds. In between there, contractions are going to be coming quicker. That is active labor. When you are in active labor, sometimes your mind gets a little clouded because of the intensity. I don't like to say pain. I like to say intense. It's very intense. It's just like you doing a hardcore workout. Okay, it's not pain. It's intense, like burning of the muscles is what you feel when you're doing your workout. Well, this is intense working of the uterus. Okay, your uterus is just intensely working. Okay, so even though it's a feeling that you can't really describe. So except it's intense. It's a feeling that you will never feel in any other situation in your life. Okay, it's a different type of feeling. Okay, so when you get to the intense portion of labor, which is the active labor, you want to make sure you keep your hips open. Keep your hips open. Keep your pelvis open. Keep it moving, okay? It does not have to be major movements. You don't have to keep walking around the room. You don't have to squat and bend over and do all of those things. If you're already in a squatted position, just rotate your hips. Just slowly rock your hips. You just want to keep the hip movement going, even if it's slightly. Even if you're just moving a little bit, and you want to move during the contraction. I like saying move during the contraction. That works better, because when the contraction stops, that's when you want to get your breath in. You want to breathe during the time when you are not distracted by your contraction. Once the contraction starts again, start moving your hips again. But at the same time, you're going to stay in that position where your pelvis is open, even during your rest phase. So your rest phase will take, it will take a 45-second drop all the way down to maybe 30 seconds. Your rest is going to get shorter and shorter the closer the baby comes down, the closer that the baby is engaging to be delivered. So you may have 30 seconds rest time in between each contraction. During that rest time, take your deep breaths. Get yourself prepared to enter into another contraction. It's your mind, and you want to speak to your body. This is your body. I believe wholeheartedly that you can command your body to do what it is you require it to do. It's listening and it's waiting on you. Do not let your body control you. Do not allow the intensity of the contraction to control you. Control your body, okay? By staying calm, by breathing, taking advantage of that 30-second rest or the 45-second rest. Do not lay down. I encourage you to stay in a seated position, you want to stay in a forward position where your body around, okay? Because of the arch that you have in your vagina, you want to make sure that you're not laying back, because when you lay back, this is what's going to happen. And that's going to create the contractions. Your mind is going to tell your body, your mind is going to say, okay, I need to release some more oxytocin. I need to release some more endorphins to cause her to contract more, because the baby is going the opposite way. If you stay slanted, you will you keep your contractions at a peak. They won't go higher than they need to. So that your contractions going to just hit a peak, and it'll keep hitting that peak, okay? Instead of having to overwork. Okay, so keep the pelvis open, even though you may feel pressure, even though you may feel uncomfortable. Keep your pelvis open. If you need somebody to sit in front of you and hold you up, that's fine. Ask them to speak while you're in labor, so people can understand what it is that you're feeling and going through, so they can help you. Okay, deep breaths. Do not pant. Don't do any of that. Okay. You have to remember that you're breathing for you and you're breathing for a baby. However, you're reacting is how the baby is going to react. Okay. And both of you are working to get the baby out. Okay. Both of you are working for the same result, a healthy, smooth delivery. Okay. So deep breaths. And you want to, at your rest time, you want to make sure you're getting as much oxygen in as you can, and you're still focusing and preparing to enter into that next contraction. So you take that deep breath. When you feel that contraction starting to peak, take that deep breath in through your nose, and then you're going to blow out through your mouth. And you want it to be a slow, concentrated exhale. So and you can push the air out. You can do that, but make sure when you're pushing the air out, you're not pushing. Okay. Do not push. Do not push. I'm going to keep saying that, and I'm going to tell you why I'm telling you do not push. Okay. Even though you feel like you need to push, even though it feel like, oh, it may feel better if I push, don't push. Okay. Just humming is fine. You can hum. Ooh, ha. In fact, high-pitched humming, high-pitched noises, that's good. Baby likes hearing that. That will bring baby down too. So you can hum, you can moan, you can groan. High pitch is better, but speaking to when you're you're speaking to baby, and baby's listening, and baby's gonna come down. Okay, it's following your voice down. Okay, just don't push. You can make all the noises that you want to make. I do not encourage you to scream because that takes a lot more energy. Okay, and screaming kind of has a tendency to cause people to get anxious. Who's with you, and scream. I don't recommend screaming. Just breathe and exhale. Inhale and exhale. Slowly, slow, concentrated breaths. Okay? Do not hold it. Oh my goodness, you do not need to hold your breath. Okay? Your breath during a contraction. Okay? That's going to cause your body to tense up. You want to be tense. You relaxed, because when you tense up, every muscle in you no longer able to function the way it's supposed to. So even it's coming, concentrated breaths. I have to breathe through it. The peak of the contraction, when it's at its most intense part, you can hum your way through that peak part as you the contraction to come down. Go ahead and take more breaths. Get system more. Okay. Humming, moaning, grunting, no. Okay. Grunting is going to turn into a push, and we don't want you to push right now. Okay. You're not there yet. You're not there. Even at the 2 to 3 minutes, you're not there yet. Okay. I'm going to give you the telltale signs to let you know when it's okay to push, when you're there, when you're in transition mode. Okay. For those of you who have possibly had problems in the past with delivering the placenta, when you begin to enter into labor, you want to make sure that you already have red raspberry tea already prepped, already brewed, and in the refrigerator. If it's already brewed and in the refrigerator, it's already cold, what you want to do is, if you have ice trays, you want to pour that tea in some ice trays. And throughout your active labor, your active labor, where you're 2 to 3 minutes apart, even when you probably get down to 15 minutes, when you get 15 minutes apart for an hour, you want to start eating those ice chips, berry tea. This is why red raspberry tea helps with the contracting of the uterus. Firm, concentrated. So the red raspberry, you want to go ahead and take that while you're actually contracting, because after the delivery, you're still going to need your uterus to contract to deliver the placenta. So if you're going ahead and eating ice chips that's made from red raspberry leaf tea, that will help you deliver the placenta with no issues. Okay, because a lot of times, a lot of reasons why the placenta doesn't come out right away is because the uterus hasn't really had time to develop strong enough contractions that are consistent, that are what's my wording, purpose. And so sometimes that will cause the placenta not to fully or properly detach. Okay, so the red raspberry leaf is really good because it's helping the uterus perform at the full capacity that it was designed to form in. So if you go ahead and have the red raspberry tea ice chips and eating that during your active labor, that's going to help you with the proper delivery of your placenta. Okay, so this is why you want to have that going into your system during labor. Going ahead and having that during labor, so that you won't enter into some hiccups after. Okay, especially if you don't have anything else, such as your labor tincture or placenta expulsion tincture. If you don't have things that will actually aid in the placenta coming out, you want to start with having those red raspberry leaf ice chips that will definitely keep your uterus working properly. Okay. I like to add ginger to my teas or to my tinctures because ginger works in conjunction with the herb. It stimulates. It allows it to. It's almost like when you are mixing an essential oil with a carrier oil to make sure that it gets further where it needs to. It's like ginger is the carrier herb to make sure that the herb does exactly what it's supposed to do at its highest capacity. Okay, so I like to add ginger. That will actually help. If you have ginger, a little bit of ginger to add into that tea, that will help also with giving you energy. Okay, giving the uterus energy to continue to function properly. All right, so red raspberry tea, have that already brewed and have that in the freezer, so you can just be eating those ice chips. Okay. Okay, so I said don't push, even though you may feel like, oh, I just want to hurry up and get baby here. I'm ready to have baby. Okay, you may feel like that, but it's not time to push. And I'm going to tell you why. You don't want to push too early, because if you do that, you can bruise the cervix and you can cause your cervix to swell. A swollen cervix is 9 times out of 10 is what causes longer labors, and it's what causes complication. Complications in labor come because we're pushing too early. Okay, you don't want to push too early, because once your cervix begins to swell, there's really no turning back until baby is delivered, and then we have to deal with it aftermath of the swollen cervix. So even though you may feel like I want to hurry up and deliver this baby, you have to still breathe through the contractions, okay? And you have to just focus on humming, focus on moaning. Do not grunt and push, because if you push, baby's head is going to be hitting up against that cervix, and the cervix is not ripe. It's not ready. Okay. And the cervix being swollen will cause, in the long run, a harder chance to deliver the placenta. Okay. A lot of delayed placentas are because the cervix. Okay. So no pushing. I'm going to tell you when to push. Okay. All right. Delivery. So you will feel tons of pressure on your rectum. Don't expect to feel pressure in your vagina. Like I feel pressure in my vagina. You feel pressure in your vagina, you're not. That just, when you feel pressure on your bottom, like you can't sit down, and you feel like you have to take this massive poop, you're ready. That means baby is coming through. His head is engaging through the cervix. Okay. When you feel all that pressure on your rectum and it feels like you're about to drop out some poop out your bottom, that means you are entering in transition phase. And it feels like you can't close. You really need to poop. That is letting you know that you are in transition, and it is okay to do a slight nudge, not a just a slight nudge, you can kind of add a little push when that contraction comes. Okay. Another telltale sign is nausea. You will feel all of a sudden a flush of emotions hit you, a flush of emotions, and you will feel nauseated, like you feel like you're gonna throw up everywhere. That's letting you know baby's head's coming through the cervix, coming over the head, and the baby is starting to enter into the canal. That is a good sign. When you figure about to throw up, that is a good sign. That's letting everybody know, okay, transition time, baby is coming through the canal. Next contraction, we're going to do a slight push. If you do a slight push and you feel baby emerging, like you can feel something moving, which you will be able to feel something like coming through, like a little push through, and that's them coming completely through the cervix. When you feel it's okay to continue to push. Okay? This is your transition time. Okay? Do not scream. Do not scream, okay? Because you will make yourself anxious, and you will startle baby as well. Both you and baby right now have a symbiotic relationship going on through labor, just like you have a symbiotic relationship going on through breastfeeding. There is a relationship, and there's an unspoken direction and guidance going on between the both of you during labor. So just like you're working, the baby's working too. If you scream, you can startle the baby, okay? Do not startle the baby. Stay calm, okay? She's calm or he's calm. Now he needs you to be calm because he's moving. They're moving off of you, okay? They're feeling everything you're feeling, okay? So you want to breathe, and keep breathing, okay? Do not scream. You can keep your high-pitched moans, your high-pitched you can even do that, okay? But you just want to do slight pushing. Don't scream. Don't do none of that, okay? Because you don't want to startle yourself. You will work yourself up, and you'll work to be shocked, okay? So, you're going to feel like you have to poop. It's going to feel like a major poop, and you can't hold it, okay? That's push time. It feels like a poop. Like, even if you don't do anything, it's still like pushing, like it's still coming out. That's push time, okay? So I still want you to do slight pushes, because you really don't have to tell you in the hospital, all that's because that baby's coming down whether you push or not. But you can just slightly give them a little push to slide on down. Okay, you don't want to do those really you don't want to do that, because then you heighten your chances of tearing. You heighten your chances of your perineum, okay? So do that slight push. You only want to push during a contraction, okay? When you're not having a contraction, stop. Don't push. To breathe. Get some more oxygen in your system. Oxygenate baby. Because remember, as long as baby is still in you, it's still attached to you. So when you stop breathing, he's not getting oxygen. So at the end of that contraction, you may feel the baby still in your canal. That's fine. Breathe. Breathe. Take that moment to breathe. Now you're giving your perineum a chance to get ready to stretch. Okay? When the contraction stops, you stop. Take breaths. Breathe. Refocus your attention on the next contraction coming. Okay? When I say you want to push, my push, you want to push like you're having a bowel movement. Okay? Push like you need to poop. Don't push like you're trying to push something out of your vagina. Okay? Push like you're trying to push poop out. So what's going to help you is you can put your chin down. Chin down. Take deep breath. Everybody poops. Everybody knows how to poop. So that's how you want to push. You want to push like you're pooping. Okay? Don't push very hard, because even if you're pooping and you're pushing hard, okay? Same thing with birth to a baby. Pushing very hard, you'll give yourself hemorrhoids. You'll pop vessels in your eyes. I know, because I've done that before. And that was in the hospital. I was going off of what they were telling me to do instead of listening to my body. Instead of listening to the baby, seeing how the baby was moving and going. And so, doing it their way actually caused me a lot more pain in the long run. So you don't want to push. It's almost the same thing. Just like you're using a bathroom, you only want to push enough for it to go ahead and come out by itself. Okay? The baby's the same way. Push like you're having a bell movement, and the baby's going to come right on out. Okay? You will feel a slight burning as the baby's head begins to emerge. that's fine. That's a good sign. That means baby is almost out. Okay. So as you start feeling that burn, you want to ease up a little bit on your pushing. Okay. When the contraction stops, if the contraction stops and you feel the baby crowning, okay, breathe. Take a deep breath and blow it out. Always breathe in through your nose and exhale through your mouth. Okay, that's the proper way to breathe. If the contraction stops while baby's head is almost out, you will feel slight burning and you will be okay. Just breathe until the next contraction. That's important because your perineum is getting more time to go from here to here. Okay, your perineum is like, it's like that. Okay, so when baby's head is coming out, it's going like this. We want it to continue to go like this, slowly. So baby's head will slowly be emerging. Okay, if it goes like this, whoop, 9 times out of 10, that means you just tore. Okay, your perineum just tore. And that just means your healing time is going to be a little bit longer. And we're trying to avoid the tearing. Okay, so even though you may feel that burn, just slowly take those deep breaths and slowly just nudge. Don't nudge. Just slowly push his head out, and you'll feel it. You'll feel it. You'll feel immediately when the rest of the head is out, because you'll feel that relief. The burning will stop, and then baby shoulders will come. Okay, the head is maybe the most I don't want to say hard, but once the head is delivered, the rest of the body is just gonna whoop. The rest of the body is gonna come out. So the head is the focal point. Getting the head is the focal point, and then after his head is delivered, everything else is just gonna whoop, just come on out. Okay, so really focus on making sure that the delivery of the head is not too fast, because I don't want you to tear and then have to deal with trying to heal without getting stitches and things like that, especially if you're not doing a hospital birth. You want to make it a lot easier on yourself, especially if you don't have anything to help with perineal tears and things like that. So when you start feeling the baby's head come out, do not jerk. Don't jump. Don't, oh, Jesus. Don't do none of that, okay? Because you'll make it go back up. Stay calm, stay relaxed, okay? Because you're going to feel that slight burn. It's fine. It's not like somebody is tearing you apart or anything. It's just a slight burn you'll feel. And just a little slight. And it feels like heat, just like a heat sensation. Don't jerk. Don't jump up, especially if you're doing a water birth. Do not jump up out of the water. Just open your legs even more, okay? When you start feeling baby's head emerge, I normally try to squat down as much as I can, even down further to the floor. I try to get down there a little bit further because I want to help my perineum stretch as well. So when I start feeling baby's head crown, I'm opening up my hips even more so that he can have more space and his head can slowly emerge out. Okay, that's what I do, and it helps. Okay, hallelujah. Thank the Father. I have not torn, and I pray that I don't ever tear during delivery. And I pray the same for you. I don't want any of you guys to tear during your delivery. So please be mindful and remember these little tips, because in the heat of the moment, we may forget sometimes, but that's why you want to focus. You want to take those times to focus on everything that you're learning. Focus on everything that your body is saying to you, even through the entire focus. Focus getting your, right now, practice getting your mind focused on delivery. Okay, baby's head is coming. Okay, now what and talk to your body. Talk to your body. Your body will listen, okay? It was designed to do that. It's designed to listen to you. Okay. All right. Placenta birth. The birth of the placenta. This is another important phase. Okay. The birth of the placenta. You want to do this with care. We're not really taught much about our placentas. Besides that, it looks like a tree, it looks like a brain. They throw it in a bucket and get rid of it. They take it from you and they get rid of it. They don't teach you about it because they understand and know the benefits in the placenta, so they want to keep it. Okay. But I believe if we learn a lot about what it is that our placenta does, if we learn about the benefits of the placenta, if we learn about its job, its function, we will treat the placenta just as delicately as we treat the baby. Remember, the placenta has been in the womb for the same amount of time that your baby has been in the womb, and it has been the source of nutrition, the source of supply, the source of getting rid of waste. Okay, that has been the baby's life support within your womb. Okay, so I want to say that before I go into the delivery of the placenta, because I think it's very important that we understand the placenta's job and we don't treat it as bio waste. Okay, it's still a part of you. It's still the fruit of your womb, and it's the fruit of your womb that has been providing for that child at the 9 months or 10 months that it's been in your womb. Okay, so with that being said, I want to say, do not force your placenta out. Everybody deliver at its own rate. The placenta is supposed to come out. Okay, as long as you're healthy, as long as you are breathing, you're not sick, baby's not sick, you are fine. Okay, the placenta is not supposed to be delivered in 20 minutes. Although some placentas are delivered in 20 minutes. It's not supposed to come out in 5 minutes. Some placenta 5 minutes. The placenta is a life source, okay? When it is ready to detach from the womb, it will detach, okay? Just like when it is ready to detach from the baby, if you are doing a, they call it a lotus birth, but if you're doing a placenta birth, you want to keep the attachment to there, it will detach when it's ready and when it's supposed to. Okay, same thing with the womb. The placenta will detach from the womb when it's ready. You want to make sure that you're waiting for it to be ready to detach. Okay, because if you remove it too soon, this is how we get ruptured placentas. Okay, try not to go by the doctor's standard, the hospital standard. Remember, women have been giving birth for the world is still going because a woman was able to give birth, and there was no doctors around back then. There was no hospitals around back then. So trust your body, okay? Do not force it out. If you force it out, you can rupture your uterus. What I mean by rupture your uterus is you can cause a laceration to be embedded on the inside of your womb, okay? You can perforate the uterus. You can put a hole in there. So do not force it out. Do not force the placenta out. It will come out, okay? You want to be very careful with the placenta, okay? To deliver the placenta, you want to sit in an upright position or rest in an upright position. If you're trying to lay down from delivery because you may be tired. I'm tired after I deliver my children, and I kind of sit up. And lean. If I'm still in the birthing pool, I'll kind of lean on the side of the birthing pool. If I feel like I can't continue to lean on the birthing pool, my husband normally gets me out of the water. And as soon as I stand up, it's like, whoop, placenta is ready to come out. So as long as you're in an upright position, your placenta will automatically begin to emerge. You'll feel like a little heavy. It'll feel like a little heavy weight, maybe like a 2-pound weight sitting at the bottom, at the base of your vagina, or yeah, you'll feel it sitting at the base of the vagina, and then it'll just slide on out. Okay, you can do a slight little nudge and it'll come out. Okay, but you want to be in an upright position. If you're laying back, it's going to delay it even more. Okay, so either sit in or rest in an upright position. Sometimes all you need to do is lean forward. Like I said, as soon as I stand up or I lean forward, mine is ready to just come on out. Okay, so sometimes that may be all you need to do, is just to sit up and lean forward, and it'll just slide on out. Do not pull on the cord. The cord is very fragile, and remember that the cord is still connected to the baby. So pulling the cord and it rupturing is almost the same as you just cutting the cord. Okay, don't pull the cord. Okay, because we don't want it to rupture. Baby is still connected to that, and we don't want it to bleed out. Okay, so don't pull the cord. It will come out. Placenta will come out. You just want to keep that area clean, keep it sterile. And if you're having difficulties, go into commanding. I'm a firm believer in commanding your body, commanding the uterus, commanding the placenta to come out in the name of Jesus, in the name of Yeshua, to detach from the womb. Go into commanding. This is what I did when after I had my daughter, and my placenta didn't come out when I was expecting it to come out, which it didn't take long. It wasn't a very long time, but I was ready to lay down. And so I sat forward, and I remember sitting on the toilet, and I'm like, okay, it's not coming out yet. And I was like, I just took a deep breath and I relaxed. Once I relaxed and I leaned forward and I commanded, I said, in the name of Jesus, I command you to loosen from my womb, and I command you to separate and come out right now. And as soon as I said that and did that and leaned forward, it just, whoop, it came right on out. Okay, so command it. If you've done everything else and it's still not moving, command it. It has no choice but to obey you. You're the owner of this body. Okay. What else do I have down here? Oh, here's a tip. Placentas detach from the middle. Okay. They don't peel. So say here's the womb. Here's the top of the womb. Most placentas are at the top of your womb. Here's, say this is the top of the womb, and this is the placenta. The placenta does not go like this. It doesn't peel like this. It doesn't do that. Okay. The placenta goes like this. It detaches from the middle, and then it comes down. So when you're commanding, command the placenta to detach from the middle of your womb and go loosen and come down. So I command you, placenta, to begin to detach right now from the middle, and I command you to loosen all sides and walls of the womb in the name of Jesus. This is the action that you want to go forth. Command it to come from the middle, and then it just detaches from the side. Okay, that's how your placenta detaches, and it just falls down and it lands on the cervix. And when you feel it land on the cervix, that's that heavy feeling that you feel. You can kind of do a slight little nudge, and it'll just come on out. Okay, it'll just come on out in one piece. But don't tug. Just let it come out by itself. Don't tug. If it's taking a little while longer, you can sip on red raspberry tea. If you have blue cohosh, and then, like I said, I add ginger. Ginger works synergistically with whatever herbs that you put together. It makes their bond work better. The ginger always mends. It's like an emulsifier. It brings things together. So you can make a little tea and just sip on that tea. And that's going to cause contractions to happen to get that placenta to come off the uterus. Okay. We want to treat as gentle as we're treating the baby, okay? Because the placenta is just like your breast, okay? Once baby is born, your breast take on the job that the placenta was doing while baby was in your womb. So think of it like that. You don't want to be all tough and rough and, firm with the placenta, because the placenta is doing the job that your breast is going to do until the baby is 3, 4, or, however long you guys nurse your children. Some people nurse their children till they're like 5 years old. Okay. So just think of it like that. My placenta is like my breast, and I want to treat my breast with gentleness. I want to treat my breast with care. So you want to treat the placenta in the same manner. Okay. So those are the tips that I had for you guys. I hope that was beneficial, and I hope that it helps you. I really do hope that it helps you. Just try to remember, if you're able to have this going, if you're able to replay this video right before labor or right during labor, go ahead. So you can just get things. Because sometimes we get information, but then we miss a couple of things. So this is why I'm making this video, so you can go back. Maybe you didn't catch something, or maybe you was like, oh, dang, what did Sister Gabby say? She said this. Oh, man, this video where you can go back and look at it, okay? I encourage you to stay strong, to be strengthened in the Most High. Be strengthened during this labor, and remember, you can do it, okay? You may have thoughts flood your mind, but those thoughts are just that. They're just thoughts. They're not reality, okay? You are reality, okay? And you make your reality. Begin to speak your affirmations. Begin to say what it is that you want to happen. Tell your body what to do, and it will do it, okay? You can do it. You were born for this. You were designed perfectly and intricately to perform this great and mighty, humbling, joyous, just amazing task. That's what you were designed to do. And I encourage every last one of you. Bless you. And shalom. If I have anything else that comes up, I'll come on here and I'll do another quick video. But bless you all. Have a successful delivery. I love you guys. Shalom.